All right, we're going to start that now. All right, so let's go ahead and get started. So this is the format for today's meeting. We've got a PowerPoint presentation that'll take approximately 30 minutes to get through. At the conclusion of the presentation, we'll open it up for general questions. I do want to say that this presentation is very informal, so you're certainly welcome to ask questions at any point throughout the presentation. If you do ask a question that's addressed a little later on in the presentation, we may ask you to put the question on hold briefly until we get to that slide. Okay, we're going to do a quick sound check. And this may sound a little silly, but if you can't hear me, please either speak up or post a chat note. And since there's so few of you, Brent, I know you can hear me okay. Amanda, can you hear me?
Yes, I can hear you okay.
Great, great. Okay, so I think we're great then. We're going to do everything audibly and then we'll go along quickly. All right. Well, again, thank you both for joining us today. Here's the agenda for today's session. Some of these topics are going to be true across all DNP programs, and some are going to be specific to the University of South Carolina College of Nursing. Again, I want to emphasize this presentation is very informal, and we encourage you to ask questions at any point that you have throughout the program. Before we get started, does anybody have any specific questions? And we'll make sure that when we get to that part of the presentation, we'll address that. So any questions before we move on?
Yes, I have one.
Go ahead,
Brent. I'm looking into y'all's program for the psychiatric NP. So
okay.
is this in service just for the DNP only, or is this kind of addressing like the nurse practitioner part?
So you're interested in the MSN program?
Yes. I'm about to enroll in my bachelor's, and I'm just trying to kind of like see what's out there. So I would have to get my MSN first and then go forward with the DNP. Is that, I understand that right?
Actually, you don't. So if you're interested in the psych mental health focus, and we're going to kind of address this a little bit in a few slides, but you can either start as a BSN grad or an MSN grad. So, and there's slightly different concentrations based on that. So.
Okay, cool. I was just making sure I was in the right place.
No, you're good. You're good. All right. Any other questions before we move on? Hearing none, I'm going to assume we're good to go. Okay, all right. Before getting into the details of the program, I did want to share that we're very proud to announce that earlier this year, we were named the #1 public university for online master's nursing programs by U.S. News and World Reports. And we were #2 overall. And this is the 6th consecutive year we've been in the top 10. And, I realize that we're talking about the DNP program today, not specifically the master's programs, but it is the same faculty and the same resources. So, it's kind of a continuation of the same. And I just thought it'd be good to show what kind of reputation the USC College of Nursing has. All right, at this point, I'd like to introduce Dr. Rhonda Johnson. She's going to be joining us today. Dr. Johnson is an assistant professor here in the college. She teaches across the BSN, MSN, and DNP programs. She received her DNP from Case Western Reserve University in 2018, her master's in midwifery in 1995 from the University of Pennsylvania, and her BSN from the University of Florida in 1994. She's been a certified nurse midwife for about 25 years, serving women and their families from all socioeconomic backgrounds. And as you can see here, she's attended about 1,500 births, either at homes, freestanding birth centers, or in hospital environments. And she considers it an honor to be at a family's birth. And Dr. Johnson will be discussing the logistics of the DNP program and answering questions as appropriate throughout the session. Welcome, Dr. Johnson. You have anything specific you want to say before we dive in?
No, I do not. Just welcome to our two guests today, and feel free to ask any questions anytime. We are here to answer those questions and to help you make the best decision for yourselves.
All right, thank you. All right, at this point, Dr. Johnson is going to give us an overview of the program.
All right, so who should get a DNP? This is and again, whether you're doing the BSN to DNP or the postmasters to the DNP, this applies to either category. So as a nurse, and Brett, in your case, since you're getting ready to start your BSN program or looking into that, it is a nurse who wants to advance their career, assume a leadership role in practice or an administrative position. It can be it is usually a practice-focused doctoral degree. So in my case, I got my nurse midwifery, my master's of science in nursing with midwifery. And then as I was practicing through the years, I decided that going back to get my doctorate was the DNP was the best option at the time of any given point in my life at that moment. So one of the benefits of getting your DNP is that you evaluate and you want to improve patient care. You are interested in quality improvement and systems leadership, and you can be a leader in any healthcare organization, or you can be a leader in your community too. So you could be a CEO, CNO, consultants, health policy specialist. You can work in academia, like I'm working in academia. But the important thing is this also helps you gain recognition in your community as a nurse leader.
Thank you.
So some of the things that are included in the DNP program is, as I just mentioned about leadership, we focus on leadership development. We discuss at great length. You have an entire course on health policy, and around all of your courses is the concept of evidence-based practice or evidence-based care. And this evidence-based is using using the research to guide how you take care of someone, whether that's the family, whether that's your hospital environment. It helps you to use that evidence that is research-based to apply the best guidelines and practices and protocols for your community. Your DNP project will show or will demonstrate a process improvement. So in some cases, as some of our FNPs, what they have done is they have, one person I'm thinking of in particular, she took access to care in her little family practice clinic and talked about including HIV PrEP and how to bring about that education and service to her little clinic in the greater Columbia, South Carolina area. So that was a process improvement within her clinic, is that she wanted to offer this service. And so she went out, sought the evidence, and tested it in her little community. Part of the DNP program is, obviously book learning, didactic, coming to class online, participating in clinical, and then also participating in immersion courses. Immersion courses are courses that actually happen here on the university campus at the College of Nursing. You are required to have 1,000 clinical hours when you graduate from your DNP program. But I will say that these total number of clinical hours will be determined by a gap analysis, and that is of your clinical background. So let's say you already have your family nurse practitioner degree or your psych mental health and you're a nurse practitioner. We'll look at how many hours you have been in, that was in your MSN program. We will apply that and then go from there. And I'll probably talk about that here in a minute or two. So what are some options? Again, Brett, in your case, talking about the BSN entry, we have 4 tracks here at the University of South Carolina. We have the adult gerontology, acute care nurse practitioner. And this is for individuals who want to specialize in the ER or in cardiac or in pulmonology. Those are kind of really target fields that your acute care nurse practitioners can focus on. Family nurse practitioners, they can work in a hospital environment. They can work in a federally qualified healthcare center. They can certainly open up their own practice, or they can be a part of a bigger practice. Again, depending on who you are and where you want to go. In both of those first two courses or two tracks, the first one, the adult care or acute care, would be 24 classes, 9 semesters full-time or 12 semesters part-time. The family nurse practitioner is about 25 classes. Again, same principle, 9 semesters full-time, 12 semesters part-time. And then the last two tracks are psych mental health, and they comprise of 24 classes. And again, same principle, 9 semesters or 12 semesters. And then if you are a nurse educator, or if you are a nurse leader currently in your position and you're looking to get your DNP, whether you have a bachelor's degree or a master's degree, that track currently for the BSN to DNP is 20 classes, roughly 8 semesters full-time or 11 semesters part-time. All of these tracks start in the summer. Regardless of what year it is, they start in the summer. So it gives everyone consistency and also a cohort to kind of balance and to, you know, to have someone to talk about that's going to start at the same time as you and go through the program at the same time. Any questions so far on that before I go to the MSN? Amanda, you doing okay out there?
Yes, so I did have a question about the immersion classes. How many of those are there, and at what is it like? Are they throughout the program or at a certain part of the program?
So can I hold you on that one, and we're going to have a slide on that. I will circle back to that. How about that?
Sure, sure.
All right. So let me go on to the MSN, and then I will circle right back to the immersions, because that's a great question. So on the MSN entry, so in my case as a nurse midwife, I've been practicing for a really long time, so I didn't have what we call a concentration to specialize in. So you have two options. You have the no concentration. And again, if you already have your master's degree, this is the track that you would most likely go on. Or if you're interested in nurse executive leadership and you want to go up to the C-suite, they call it, then this would be the appropriate track. The no concentration, roughly 11 classes, and 6 semesters, and it's part-time, so you can work and manage. Or you can do the nurse executive, that's about 12 or 13 classes, depending on your background. It's 7 semesters long, part-time again, and it only starts in the fall. So again, for planning purposes, if you were interested in fall of 2021, that's when you would start. All right, next slide, please.
And I just wanted to clarify one thing. So the folks doing the non-concentration would be people who are coming in with NP degrees already. Whereas nurse executive leadership would be people who've got masters in something other than an NP. So maybe nursing administration, something, you know, something else along those lines. So
nurse educator, you know,
right.
Something along those lines.
Right. Thank you. Dr. Johnson, do you want to explain the difference between part-time and full-time, how many classes that is per semester?
So usually in the BSN program, that's roughly 3 classes a semester. So it is I mean, when we say full-time, you know, we think about in our undergrad program that 4 classes was typically full-time, but in the graduate level, because there's usually more writing, more outside, outside didactic experience. In other words, you have to do clinical. It's usually for the BSN to DNP, it's 3 classes a semester. In the MSN, it's roughly 2 classes a semester, and that's why it's considered part-time. So roughly 6 credit hours is considered part-time, 9 credit hours is considered full-time.
Thank you.
You're welcome.
And before we move on, I just want to make sure I've got this right. So Brent, if I'm not mistaken, you'd be doing the BSN track to the psych mental health, is that correct?
Yes, sir.
Okay, and Amanda, I think you're looking at the BSN FNP, correct?
Correct.
Great, all right. All right, before we move on to the next part, any questions about the different concentrations or any of those related items? Okay,
No.
let's move on.
All right, so what are the requirements? And this, Amanda, will tie into what you're talking about. So we have the didactic. Every course in the DNP program, whether it's the BSN to DNP or the MSN to DNP, is all online. Some people do really well with nothing but online courses and classes for the didactic part, the book learning, I call it. Other people, sometimes it's a semester or two until they really feel comfortable with it. I will tell you that it took me a semester or two, and I'm being forefront and honest, to really get into the swing of being an online student. As far as being online faculty, same principle. When I first started teaching a few years ago, it took me about a semester to kind of get the hang of it. So we always remind students, to be patient with yourself, because it is, if you've never done it, it is a little bit different than being face-to-face or being in a hybrid program. A lot of benefits to it. Benefits being that you can study, you can review lectures, 2 o'clock in the morning, or you can review them at, 3 o'clock in the afternoon. It just depends on your schedule. You make it work for you. But with that being said, there's a lot of responsibility being self-directed. Immersions, and again, going back to you, Amanda, are on-campus checkoffs. They're in the FNP program, since that's your specialty. They have one in the, I believe there's one in the beginning. There's one in the not the acute care, in the health assessment course. And this would apply to you as well, Brett. If you're in the psych mental health, there's a health assessment course that you have a checkoff at the end of the semester. And then there is another one. There is a new one that we're starting in the DNP or the MSN program. That is a combination and if you're in the FNP, and this goes specifically to you, Amanda, there is a pediatrics and maternal and women's health component. And at the end of that course, there is a 2-day immersion related to those topics. And it's kind of like an unfolding immersion. So for example, that course is offered in the spring, so it would be roughly at the end of April that those immersion experience would take place. The last immersion for the FNP track is in the chronic care. And if you think about chronic care, that means like people with diabetes, high blood pressure, autoimmune disorders, so that particular immersion also would be towards the end of that course, whenever that course is offered. And Scott, I don't know when that one is routinely.
I don't know.
Yeah, I don't know either off the top of my head. Amanda, does that answer your question about immersions? They're usually 2 days, sometimes 3 days long.
Yes, it does. That clarified. I was wanting to just clarify if this was like a full semester, so many days per week, or if this was just like a set, for checkoff type things. It sounds like a 1 or 2 day event that happens at the end or some part of that class. Is that right?
Right. Now your health assessment course, that one is going to be a 3-day event. And here's the slide about that. So if you're in the acute care track, you have 3 days for 704 which is health assessment, and then you have 2 days for nursing 774. FNP, just like I mentioned, 3 days for the health assessment, which again is 704. Same thing with the psych mental health, 704, 3 days. It's usually a Monday, Tuesday, Wednesday, by the way, just so you can visualize that. And then the acute care and FNP have, or the FNP, I should say, has 2 more sessions of immersions. Is that okay, Amanda?
Yes, thank you for explaining that to me.
No worries. So what are the requirements? Well, As mentioned, if you're in the BSN to DNP track, you're going to have clinicals, and you're going to, and we'll discuss what your requirements are after you are admitted. You will have to find your own clinical placement, and then travel may be required. Now, I will qualify that as if for some reason you are like, for example, some of our students had a really hard time during COVID with clinical placement. So we were able to help them find a clinical placement, but we can't guarantee that that's going to be in your backyard, for lack of a better term. So you may have to travel a bit in order to go to a clinical experience. But we encourage you to reach out to your friends, your colleagues. We recently had a student who emailed all of her providers and just said, hey, do you mind taking a student? And one of them said, yes, we would love to have you. And she's had a great experience with that particular person. So any questions about clinicals? All right.
All right. We're actually going to transition to the admission part now.
Oh,
so
all right.
Does anybody have any questions about any of the logistics or academic portion before we get to the admissions portion? Okay, let's move on. So what's required for admission? Again, at this point, I'm going to jump back in and do that. As mentioned previously, we do admit students either with a BSN or an MSN. If you've got multiple degrees or attended multiple schools, we'll determine what's called a cumulative GPA based on all your prior coursework. This includes any classes you took for college credit, whether it was in high school, a summer course you took while you were in college, anything like that. We prefer applicants who have an overall GPA of 3.0 or higher in all coursework. I do want to emphasize that our programs are competitive for admission, and the average GPA of admitted students often ends up being much higher than the 3.0 minimum, but that's not all that we look at. So, and we'll go into that a little bit more in just a minute. We also need a current copy of your unencumbered nursing license for the state from which your requirements will be satisfied, so where you live and or where your requirements will be satisfied. I do have to say, you see the little asterisk there. About 2 years ago, some of the state boards of nursing started imposing restrictions about students within their state enrolling in online courses outside of your state. So we're not currently allowed to admit students from every state. We're up to about 22 states we can admit students from, but there's, again, several that we can't. And if you want to know more about those, they're listed on our website, or I can talk to you individually about what your state is and what your status is. Finally, everyone who satisfies the requirements listed above and looks like a viable candidate, we contact for an interview. Typically, interviews are conducted either via Zoom or Teams. Okay, so what's the application process? Interested applicants must complete an online application. The application includes a goal statement and a current copy of your resume or CV, as well as your nursing license. Your goal statement should describe the advanced practice role and scope for which you're applying. Be sure to indicate how the program will advance your professional goals. If there are any unique circumstances in your academic or career background, this would be an appropriate place to include that information. I also encourage you to keep this brief. Try to keep it to 2 pages or less. You have to remember the admissions committee is reviewing, somewhere between the neighborhood of 50 or 100 applications, depending on the program. So, try to keep it brief and concise why exactly you want to do what you want to do. If you're applying to one of the clinical programs, so acute care, FNP, psych mental health, you also need to include a copy of your BLS certification. I know neither of you are acute care track, but that also, that track requires ACLS certification. You need to include 3 recommendations from individuals who are doctorally prepared in the healthcare field. This could be somebody with an MD, DO, PhD, DNP, and a few other options. When you complete the application, you'll list the names and a contact information for these individuals, and they'll be sent an electronic link that will go to a recommendation form, so they can complete the form online and submit it electronically. So you don't have to worry about physically collecting a hard copy recommendation letter. We need to receive copies of all transcripts from anywhere that you receive college credit. Again, even if it was one class in high school, one class during the summer, that sort of thing. We can use unofficial copies of your transcript for the application review process. If you're admitted, we'll need official copies at that point. If you've got unofficial copies, you're certainly encouraged to upload them with your application as well. Some students will just go ahead and submit all official transcript, but if you want to do unofficial transcripts initially, that's fine. That may save you a little upfront costs. All applicants also need to submit a verification of work hours form. This confirms that you've had at least 2,400 hours work experience as a nurse within the last 24 months. This is roughly 1 year's worth of full-time experience. You can access the form through the application, and this will confirm both the total number of hours and the setting that you've worked. As you can see, we do not require GRE or any other kind of standardized tests. And again, most of these items can be uploaded with your application. Some of them you actually have to upload before you'll be able to submit it. Also, it's important to note here that all required items, transcripts, license recommendations, etc., must be received before your application can be sent to the department for review. After you submit your application, you can log back in to see what items have arrived and been processed and what we're still waiting on. Once you submit your application, I'll be in touch with you, and after I review your application, say, hey, we've got this, but we're still waiting on this recommendation, or we've got this transcript, but I see transfer credit from this school, we need this. So you're certainly welcome to reach out to me at any point throughout that process as well. And finally, we do encourage you to submit your application well before the application deadline. If you wait to the application deadline, that's when the majority of people submit their materials. And quite frankly, it's going to take longer for everything to get processed simply because there's more information processed at that time. Also, we try to turn around and get all the applications sent to the department about a week after the application deadline. And if you submit it, let's say you submit your application a month before the deadline, if there's an outstanding item, that gives you much more time to get it in than if you submit it right at the deadline. All right, as far as deadlines, here are the deadlines for the BSN entry students. You can see there the priority application deadline was October 31st. We're going to continue accepting applications on a rolling basis till February 1st. You can also see the deadlines there listed for the the postmaster's entry students. Again, I know neither of you are in that category. Again, regardless of which deadline applies to you, encourage you to submit all your applications well prior to the deadline so you can get everything processed and you have a little bit more time to get everything submitted. And whenever possible, we encourage people to apply for the priority deadline. This is where you should send everything. Again, most items can be uploaded with your application. Any official items that you're having sent, for example, transcripts, they can be sent to the address listed here. After you submit your application, you won't be able to log in and add anything else to it, but you can send things to the email address listed here in the graduate school. And again, depending on when you submit your application and your other items, sometimes it can take up to a week or more for everything to be processed and added to your file. And again, I'll review and let you know when your application is complete or what outstanding items you have. And finally, I'll also let you know when your application gets sent to the department for review. I've added a couple links here. The first is the one that goes directly to our DNP website. The second link there, it goes to the graduate school application. And some people have asked recently, are there multiple graduate applications, one for this university and one for the College of Nursing? No, there's just one application. There are parts of the application that are specific to nursing, but it's all just one application you need to submit. All right, we have covered a whole lot of information. So now it's your guys' turn. What kind of questions do you have?
Okay.
This is Amanda. So,
Go ahead, Amanda.
oh, okay, sorry. So I had submitted my references through the master's, application process. Do I have to send in new references if I go, if I go forward with the interviewing process for the DNP?
Right, good question, Amanda. So your situation's a little bit different. You applied to the master's program and actually were recommended for the DNP program. So based on that, we can use the recommendations that were previously submitted. So you wouldn't need to submit any additional recommendations.
Okay, thank you.
Okay. Brent, I think you had a question?
Yes. So I live in Texas, and so basically what I'm doing, I'm applying at a lot of schools throughout the United States. And if I get accepted to South Carolina, is there, well, let me think. So if I get an application, by October 31st or February 1st, and I get accepted, do I have to start by the summer, or can I roll it over to the following year? Is that possible? Because I'll have to relocate and set a lot of things up.
Dr. Johnson, you want to handle that, or you want me to respond to that one? You're muted right now. Dr. Johnson, you're muted.
My error, that happens with online. So let me make sure I understand your question. So you are, let's say it's next year, and you are applying for the BSN to DNP program through the Psych Mental Health. And the deadline is February 1st. And let's say we notify you March, April timeframe that you've been accepted into the program. But you would like to possibly defer it for a whole year. Is that my understanding?
I mean, if I had to, I would like to get over there and get started as quick as I could, but just in case if I couldn't get a job lined up, place to live, all that good stuff, I just wanted to know if that's a possibility, if I'm having trouble getting set up.
My understanding, and correct me if I'm wrong, Scott, is that is a possibility, and it's done by case situation. Is that not true, Scott?
It really depends. Again, it's a case by case situation. Typically, they try not to defer admission for anybody who's enrolled in a clinical program, because there's a limited number of clinical spaces. But we did it this past year because a lot of people were having issues related to COVID and that sort of thing. It's something we could address. Now, Brent, probably more importantly, you don't have to be in South Carolina to do the program. Yeah, I mean, you could easily do the entire program from Texas. The only time you truly need to come to South Carolina would be for your one immersion course for 3 consecutive days. So you could completely get everything done from Texas. And we've got several students who complete the programs from elsewhere outside of South Carolina.
Okay, so let me ask you this. If I'm going to do the program from Texas and it's 100% online, except for the immersion, do I still have to pay out-of-state tuition fees?
The way the university defines on-campus versus online courses, technically it's not considered an completely online program, because it includes both immersion and clinical courses. So the only nursing program that we offer that is considered completely online is nursing administration, because they don't have any on-campus requirements. So now, one thing I will say is, I guess it was last week, got an email from the dean that she has, I don't want to give a number, but it was a lot of scholarship money available for incoming students, and specifically targeted for DNP students. And one of the things that we've tried to do recently is give scholarship money to out-of-state students that actually reduces their tuition to not exactly the same as in-state tuition rate, but what they call near in-state tuition rates. So that's a good way to kind of reduce your tuition significantly.
Okay, I have one more question, if you don't mind.
Sure, go ahead.
So I'm starting my BSN program in Texas in March, and it looks like I'm gonna have maybe 1 or 2 classes kind of still hanging on, I guess in the spring of 2022. So my question is this: if I have a class or two that I'm still waiting to take, would I still be able to apply if I'm almost finished with my BSN?
Do you have your ADN? Are you already practicing as a nurse?
Yes, I've been an LVN for 15 years, and I got my ADN about 6 months ago.
Well, congratulations on that.
Thank you.
You're doing a great, bridge. I call it like a bridge program, and those are wonderful. That's, congratulations on all those accomplishments. So, the key is that 24-hour or 2400 rather, not 24-hour, 2400 requirement for being a registered nurse. So as long as you have that 2,400 hours, 2,400 hours of working as a registered nurse, an RN, then my understanding is that you can apply.
Okay.
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 Yeah, and Brent, typically they do want to see that you've actually graduated, but it sounds like we're still at least a year away from applying. So,
Right.
let's touch base this time next year, and the rules may have changed slightly, or that sort of thing.
I got you. I'm just I'm trying to find the end game and go backwards from there, if
I
that makes
understand.
sense.
No, that's a good plan.
And one more question. Sorry, I think this is the last one. I've taken statistics 10 years ago. I've actually enrolled into a stats class to start in January. Does the stats class have to be within a certain amount of years, or would the 10-year stats class apply?
That one's above my pay grade, as I like to
Okay.
say. I don't know the
Yeah.
answer to
Okay.
that one.
Gotcha.
Brent, technically, there are no specific prerequisite courses for the program. Okay. Then the main prerequisite is that you've got your BSN, that you've got your nursing license, that you've got the work experience. Those are the main things. Now, if you did have courses, then we would look at that during the application process and determine if there's anything potentially that you could get out of. But typically anyone entering into the BSN, the DNP program, most folks wouldn't have any graduate level nursing courses coming in. So if you had something at a graduate level, it's possible that 1 or 2 of those could transfer or be waived. But don't worry about specific courses that you had as an undergrad, that sort of thing.
Okay, gotcha. All right, thank you.
Good question. All right, good. What else? What other questions do you guys have?
Amanda, do you have any other questions or concerns or just random thoughts about it that we can help you with?
I guess the one thing I just maybe you can help. I know it's individual, but how feasible is it? I work part-time, but how feasible is it to work part-time and do the program full-time?
So again, you're looking at the BSN to DNP program full-time, correct? Is that that's what?
Correct.
That's what, okay. So that would be my recommendation to you is, and this is just a recommendation. Every family is different, but we would recommend that you can work part-time through the full-time program. Where students sometimes get challenged is when they're working full-time, because we know as nurses, we don't work just a 36-hour shift. We end up working, an hour after, we show up early, we fill in, we do all those wonderful things because we're nurses and we just do those things. We jump in when we can. So if we just cautious, you have to really be organized if you're going to work full-time and go to school full-time, especially when you're taking 3 graduate courses a semester.
And let me add here, Amanda, if it makes you feel any better, The majority of our students are working either full-time or part-time, so it's certainly feasible. I'll also say that if you start full-time and you find that that's overwhelming, you can always drop back to part-time, and that's not a problem at all. It would be much easier to do that than to start part-time and then change to full-time, simply because not every course is offered every semester, that sort of thing. The transition from full-time to part-time would be much easier. Now,
Okay, that was
I'll give
going to
you
be one of my
example.
questions.
I'm sorry, go ahead, Amanda.
No, that was my next question, but you answered it about if you know, I started full time and thought, okay, this is a little too much, you know, are you stuck in that, or can you back down to part time?
No, absolutely, you can change. And again, the transition from full-time to part-time would be much easier than the reverse. The one student who I spoke with who was actually working full-time and going to school full-time, well, and let me add in here that probably the most challenging time is when you're also doing your clinicals. So what she did is she did her clinicals during the week and then worked at the hospital on the weekends, like Friday, Saturday, Sunday, you know, full shifts. And that's how she was able to do her hours. You know, so a lot of it depends on where you work, what their hours are, where you're doing clinicals, what their hours are. So, you know, if your clinical placement has flexible hours, you know, they're open 24 hours, then you may have a lot more flexibility than if you're doing your clinicals in a 9-to-5 job and you're working a 9-to-5 job. All right. What other questions? We've got time carved out until 1 o'clock here, but I also want to be respectful of your time. Does anybody have any other questions before we move on?
I have one more.
Sure.
So I don't know if you guys know this, but I'm working psych right now. I work in a drug and alcohol treatment center, and I work with a lot of psychiatrists. So I have a lot of possibilities for preceptors there. Can I have a preceptor that I work with? Is that okay to do?
So our recommendation is that we try to be as accommodating as possible. The problem with having your preceptor be someone that you directly work with is that there is that chain of command. And again, I come from a military background. So if you have someone who is evaluating you both for your full-time job or part-time job and evaluating you clinically, there's this inherent bias in there. So we would discourage you from doing that. We would prefer that you work at a different unit than the one that has direct, is part of your evaluation. We don't want anyone that's in that direct line of evaluation for you. And besides, it also enhances you to go to other clinical sites or other clinical experiences so that you can have that breadth of wisdom from other individuals who are practicing.
Okay, gotcha. Thank you.
You're welcome.
And Brent, let me add to that too, that let's say you worked in a hospital system, and if you work in, say, the psych unit, you probably wouldn't be able to do or wouldn't want to do your clinicals there, but you could certainly do them in like the ED or labor and delivery or someplace else. So you could still work in the same company, but just not under your current supervisor in a different area.
Gotcha. Okay.
All right. Any other questions? Now's your time, guys. You've got a captive audience. So if you want to get one-on-one attention, this is the time.
I think I'm good.
Okay. Well, as you can see, I've added my contact information there. I think Dr. Johnson would also be happy to answer any questions you have. Her contact information is on the website. If at any point throughout the application or admissions process you have any questions, don't hesitate to reach back out. And just thank you both for joining us today. And